Okay, today we have a patient that has a problem with one of their front teeth. Basically this patient has had a crown done on a tooth that at one time had decay or had a traumatic injury, and it eventually caused the nerve of that tooth to die and caused an abscess in the bone. So what we're doing today is we are going to do a procedure called a root canal therapy, which is something that most people have heard of and most people are potentially scared of. But what you'll find out though is that it's really a very simple procedure, and it's a way for people to save their teeth. So what we're going to do on this patient is we're going to anesthetize this patient in this area and do this root canal therapy right here, so that rather than him having to have the tooth removed, he can save that tooth. Okay, first thing we're going to do... Okay, fine, good.
And you need to put the glasses?
Yes, we'll do that here.
Glasses.
I'm going to rub a little bit of this topical anesthetic here. This is a benzocaine, and I just like to rub that in right there. Hand me a cotton roll, please. And that just kind of holds that in place. We're also going to get the patient... We like them to at least make them look good while we do this, so we give them a little safety glasses here. You can adjust that if you need to. Okay, we're just going to give you just a little bit of numbing stuff right here next to this tooth. Okay, and just a little bit more on the back side here. Okay. Are you doing okay?
I'm doing fine. I didn't feel a thing.
Okay, great. What we're going to do first is what we like to do is isolate this tooth with what they call a rubber dam. So I'd like to try this on to make sure it fits properly. And what you'll need to do is let me know if it is uncomfortable in any form or fashion. Turn a little to your left right there. Now, is that uncomfortable? Is it pinching you in any way?
Mm-mm.
Okay. So let me take that off. What the rubber dam does is just allows us to isolate the tooth so that nothing will fall the back of your throat, or kind of allows you to swallow without stuff getting back there or anything. It allows me to have a clear field of vision and be able to see things much clearer.
So if we get a geyser of pus, it doesn't go down my throat?
That's correct. Okay. Is that okay? Mm-hmm. Is that uncomfortable? Let me get a plastic instrument. get this to work now. This may or may not work for us. And we use a lot of water in this procedure, so we'll do our best to keep it dry here. If at any time, if you need me to stop for any reason, you just raise your hand for me. Let's see a 10. And what these are little files that we use that will help us clean out the nerve that's no longer alive. As you can see, it just fits down into the canal itself. Okay. And what we're going to do is I use a device called an apex locator that helps me determine how long the tooth is. Now, sometimes when people have crowns, this won't work, and then we have to use x-rays. But if we can use this, it makes the procedure much faster. And what it does is it just uses a little electrical pulse that helps me determine the length through a circuit. And sometimes you get that. If it hits the crown, sometimes we won't get a reading, so we have to do it with an x-ray, but we're going to try to do it this way.
we've got quality assurance tests that get done where an auditor comes in and it's a bullpen, and it's a surprise visit. You never know when he's coming. And I have some online training that I've been procrastinating on, and she's threatened my life that it has to be done by today because we're expecting it.
This. Let me get the black.
I stayed till 7:30 last night working on it.
How long does it take to do it or whatever?
I've never done it before. I mean, I even have my front desk helping me doing it last night. I left late, still can't even finish it. So I gotta get back and get that done.
So they just show up.
Yeah, it's unreal. And of course, we're trying to get everything to be exactly perfect before they come. So.
Is she from around here or?
Yep, she's from Duncanville. She's the only child, and she's very fortunate.
Put this back.
Awesome. But she's single, so she can, come and go to easily. This is her life, There's a kind of doing that to live life.
Yeah.
That'll be true.
Okay. What we'll have to do in this case is take an x-ray of it. This is the hydrogen peroxide. And I just like to rinse the canal out real well. Allows me to get a better seal. Okay, if we can get a 25. These are at 21? At 30. And a 35. And what we're doing is just increasing the size so that we can have enough room inside the tooth to seal it with a gutta percha material. Are you doing okay? Canal out. So again, when we put the sealer material in there, it's going to seal it properly. Okay, good. And if we can get a 35. And what I like to do is measure this. We'll probably get one more of those out, but I'd like to measure this to make sure it equals what I did with my file. And we are right at 21, so that's perfect. Here's what we're looking for on the length. Like I said, normally I can I can do that with this without taking an x-ray, but when you've had a crown done, sometimes we have to use the x-ray. But what we're trying to do is verify how long the tooth is, because we want to be able to seal that tooth against further bacterial infection. So that's the whole point, is to try to save this tooth by sealing it away, allowing your immune system to kick in and eliminate the infections. Okay, turn to your left a little bit. There you go, perfect. Okay, so if you can take a look at this, Kathy, over here. We've now sealed the tooth. This is the sealant material along with the gutta percha. If I shrink that, you can see that basically we've got we're just got we figured out the length of the tooth, and now we've sealed it. Okay. I won't need it. Let me get this small condenser. And then what we're going to do next is we're going to condense this a little bit more, and then we're going to put a permanent filling in there, and you'll be done.
Great.
You have a plastic instrument. Okay, let's take that off. Okay. Can you bite together and tell me if that feels okay to you? Mm-hmm. Let's see, bite together and hold. Okay. How does that feel to your tongue? Does it feel smooth?
Fine. Yeah.
Okay. Okay. That's all there is to it.
Right.
We've finished the root canal start to finish in less than 30 minutes. It was very straightforward, very easy. Everything turned out just like we want it to. Now we just need to follow up on a regular basis to make sure that the tooth heals up and that you don't have any problems. And we'll do that based upon taking future x-rays just to compare it, and also to based upon symptoms, meaning that as long as you're not having pain or discomfort or anything like that.
Okay.
And so otherwise we've accomplished everything that we wanted to do in a very timely, painless manner.
Great, yeah, didn't hurt at all. That was great.
So, great.